Meanwhile, about 45 health staff of the Winneba Trauma and Specialist Hospital have been asked to go home and self-isolate pending the outcome of their COVID-19 test results. According to the management of the hospital, the staff have been exposed to a COVID-19 patient who stayed in their facility for a week. 3 units of the hospital have been shut down as a result. Richard Kojoyako joins us with an update. Richard, what more do we know about this case that came in?
45 staff of the Winneba Trauma and Specialist Hospital, they've been asked to go home and self-isolate. This follows a COVID-19 patient that they got exposed to. The person used the 2 main wards or 2 main units, the accident and emergency unit, and then the male unit as well. And so this has sparked some concerns among the health staff. They say that they have family members, they are going home. Now their samples have been taken, and so if they go home, they do not know their status, and it takes a very long time for their test results to also come in. And so they are urging them to fast-track the working on the test samples so that they could receive them in time. Then they don't expose their family members as well as other associates of theirs. This man came, we are told that he showed some symptoms of COVID-19, but because they did not have a holding bay, even though Winneba, the trauma hospital, has been designated by the Regional Health Administration as a treatment center, but they do not have a holding bay. So if they had a holding bay, they would have held the man there pending the outcome of the test samples, and then he would have been sent to the treatment center. And so that is why some of these 45 health staff have been exposed, and now they have to go home and self-isolate.
Richard, help me understand this. The trauma center was designated as a treatment center for COVID, right? Exactly. But they don't have a place to keep COVID-19 patients.
Yes, so people that they suspect have, they suspect they have COVID-19, yeah. And so if the people come to their facility, they still hold them at the general facility. So in this case,
with other patients.
Exactly. And then the health officials would have to attend to the person directly without sending the person to the holding bay, and then pending the outcome, and then the person will be sent to the treatment center.
Have the hospital authorities responded to this in any way?
Well, they sent the message by way of update to the health staff, and so the health staff, they have taken notice of that one, but they are complaining that they are inadequate PPEs because when the man was brought in, the man was clearly showing symptoms of who a COVID-19 patient is, and then instead of doing something about it, the person was kept in these units until the test samples were brought.
Richard Kojoyako, thanks so much for joining us.